Dr. Alex welcomes you to this video. Your health is your wealth, and early detection and intervention can make a world of difference. Welcome back to our YouTube channel, Silver Fox Nutrition. Today, we're going to a crucial topic that affects many of us: signs that your liver might be trying to send you a message. If you ignore these signs today, your liver may suffer a lot in the near future. In this video, we'll explore 15 weird signs that could indicate your liver is facing some challenges. But fear not, because along with each sign, we've got some key precautions you can take to keep your liver happy and healthy. But first, if you're new here, don't forget to hit that subscribe button and ring the notification bell to stay updated on all things health-related. Now let's jump into the fascinating world of liver health. All right, let's kick things off with Section 1, dark urine and pale stool. These might not be dinner table conversations, but they're crucial signals our body sends when our liver might be waving a red flag. First up, dark urine. Picture this. You flush, and it looks more like amber than the usual pale yellow. That's your body dropping hints. Dark urine can be a sign that your liver is struggling. Why? Because one of the liver's many jobs is filtering waste, and if it's not functioning properly, it can affect the color of your liquid gold. Now, onto pale stool. Not exactly a topic you bring up at brunch, but we're here to spill the tea on all things health. If you've noticed your stool is looking paler than usual, it might be because your liver isn't producing enough bile. Bile gives your stool its brown color, and when there's a glitch in the liver's bile production, things start to fade. Here are some suggestions for you. Hydration plays a significant role in urine color, so make sure you're drinking enough water. Sometimes, dehydration can give a false alarm. But if your urine continues to resemble a dark brew, it's time to chat with your doc. As for pale stool, it's not always a sign of liver issues. Dietary changes can play a role. However, if it persists along with other symptoms, it's a cue to schedule that appointment. Now, the crucial part is, these signs can often be subtle, and it's easy to overlook them. But our bodies have this incredible way of communicating, and we need to listen. If you've been noticing these changes, consider keeping a health journal to track patterns. And, of course, consult a healthcare professional. Listen, we're not here to scare you, just to empower you with knowledge. If you're finding this information helpful, don't forget to hit that like button and share it with anyone you think might benefit. Sign number 2 is mental changes. Yes, your liver doesn't just play a role in filtering out toxins. It also has a connection with your brain. So have you ever found yourself struggling with concentration, feeling a bit foggy, or maybe experiencing memory lapses? These mental changes could be subtle indicators that your liver might be facing some challenges. The liver plays a crucial role in detoxifying the blood, and when it's not functioning optimally, toxins can affect your brain, leading to cognitive issues. Now, let's talk about precautions. First and foremost, don't brush off changes in concentration or memory lapses as just a sign of a busy lifestyle. If you're noticing persistent cognitive changes, it's time to bring it up with your healthcare provider. These changes can be caused by various factors, and your doctor can help pinpoint the root cause. Next, let's talk about lifestyle factors. Adequate sleep, regular exercise, and a balanced diet contribute not only to overall health, but also to brain function. Prioritize these lifestyle factors to support both your liver and cognitive well-being. And here's a golden rule: stay hydrated. Hydration is key for optimal brain function. Dehydration can affect your concentration and mental clarity, so make sure you're sipping on that water throughout the day. Remember, our goal here is to empower you with information. If you're finding this content valuable, give us a thumbs up and share it with others who might benefit. Take care of your mental well-being, stay hydrated, and don't hesitate to seek professional advice if you notice any unusual changes. Let's move to the next signs indicating liver damage. The next signs. Sign number 3, jaundice and unusual skin changes. Now, jaundice is like the rock star of liver issues. It grabs all the attention. If you've ever noticed a yellowish tint to your skin or the whites of your eyes, It could be a sign that your liver is sending out an SOS. But here's the thing. Our liver can also throw some curveballs that aren't as obvious. Ever had that itch you just can't shake? Well, it turns out your liver might be behind it. Liver problems can cause intense itching, and it's not your run-of-the-mill scratch-and-go situation. It's more like a persistent, irritating kind of itch that demands attention. So if you find yourself in an unending battle with the scratch monster, it might be worth looking into. Now let's talk about unusual rashes, not the kind you'd typically associate with allergies or skin conditions. Liver-related rashes can be different, more subtle. They might not scream liver problem at first glance, but they're like the secret agents of skin signals. Keep an eye out for any mysterious skin changes that don't have an obvious cause. As fascinating as these signs are, it's crucial to note that they don't guarantee a liver issue. They're like breadcrumbs. They lead you in a certain direction, but you need the whole trail to make a diagnosis. If you spot these signs, it's time to play detective. Consider factors like changes in diet, medications, or recent illnesses that could contribute to these symptoms. Now, here's the crucial part. Don't self-diagnose. I know the internet is full of information, and it's tempting to play Dr. Google, but it's not a substitute for professional medical advice. If you're experiencing persistent jaundice, itching, or unusual skin changes, it's time to reach out to a healthcare professional. They're the real MVPs in decoding these mysterious signals from our bodies. Listen, your health is a priority. And understanding these signs is the first step towards taking better care of your liver. Subscribe for the next section where we unravel more weird signs of liver damage. And don't forget to hit that like button if you're finding this information helpful. The next sign of indicating liver damage is abdominal swelling and pain. It might not be the most glamorous topic, but your abdomen holds some important clues about the health of your liver. First off, let's talk about abdominal swelling, also known as ascites. Imagine feeling like you've got a balloon in your belly that just won't deflate. That's what some people with liver issues might experience. The liver plays a key role in regulating fluid balance in the body, and when it's not functioning optimally, fluid can accumulate in the abdomen, leading to that uncomfortable swelling. And then there's abdominal pain, a signal that our body uses to grab our attention. Now, not all abdominal pain is related to the liver, but if you've been experiencing persistent discomfort, it's time to play detective. The liver is situated on the right side of the abdomen, so pain in that area could be a sign that something's amiss. Precautions are in order, my friends. While abdominal swelling can have various causes, if you notice a sudden increase or if it's accompanied by other symptoms, don't brush it off. Consult with a healthcare professional to rule out any serious underlying issues. As for abdominal pain, it's like a red flag your body is waving, signaling you to pay attention. Now, it could be related to something as simple as gas or indigestion, but persistent or severe pain should not be ignored. It's time to pick up that phone and schedule that appointment with your doctor. Remember, we're not here to scare you, but to empower you with knowledge. If you're finding this information valuable, give us a thumbs up and share it with friends who might benefit. Now, on to the next precaution, maintaining a healthy lifestyle. Regular exercise and a balanced diet contribute not only to overall health, but also to the well-being of your liver. So let's keep those bodies moving and nourished. In Section 5, we're tackling the unexpected weight loss. Yes, it's not always a celebration when the scale moves, especially if you haven't been trying. Unexplained weight loss can be a subtle yet significant sign that your liver might be sending out an SOS. So you step on the scale, and there it is. You've shed some pounds without even trying. Now, before you start celebrating your newfound weight loss plan, pause for a moment. Rapid and unexplained weight loss can be a red flag. The liver is a metabolic powerhouse, and when it's not functioning properly, it can affect how your body processes nutrients. This can lead to unintentional weight loss. Now, the precautions. First and foremost, don't ignore it. Sure, weight can fluctuate for various reasons, but if you're dropping pounds without any changes in diet or exercise, it's time to investigate. Consult with a healthcare professional to rule out any underlying health issues. Next precaution: keep an eye on your appetite. If you're experiencing a sudden loss of appetite or constantly feeling full, it could be related to liver issues. The liver plays a crucial role in digestion and nutrient processing, and when it's not in top shape, it can affect your eating habits. Now, let's not forget about the importance of a balanced diet. Proper nutrition is key to overall health, including liver health. Ensure you're getting a variety of nutrients through a well-rounded diet to support your body's functions. Remember, our goal here is to empower you with information, not to instill fear. If you're finding this content helpful, give us a thumbs up and share it with anyone who might benefit. Now, let's unravel Section 6, Changes in Appetite. Our relationship with food can say a lot about our health, and when it comes to the liver, it has a role in how our appetite behaves. Ever had those days where food just doesn't hold the same appeal? Or perhaps you find yourself feeling unusually full after just a few bites. These changes in appetite can sometimes be subtle indicators that your liver might be trying to tell you something. Imagine your liver as a traffic controller for nutrients. When it's not working at its best, it can affect the signals it sends to your brain about hunger and fullness. So you might notice a sudden lack of interest in food, or on the flip side, feeling full faster than usual. Now, on to precautions. If you've experienced persistent changes in appetite, it's worth keeping an eye on. Don't dismiss it as just a temporary shift. Our bodies are excellent at dropping hints. It might be a good idea to maintain a food journal, noting any unusual patterns in your eating habits. Next up, don't forget the basics: hydration. Sometimes our bodies can confuse thirst with hunger. Staying adequately hydrated can help ensure your body's signals are clear. So, drink that water and keep those hydration levels in check. And here's a golden rule: don't skip meals. Consistency in eating helps maintain a healthy appetite and ensures your body gets the nutrients it needs. A well-balanced diet contributes not only to overall health, but also to the functioning of your liver. Remember, we're on this journey together to understand the signals our bodies send us. If you're finding this information valuable, give us a thumbs up and share it with others who might benefit. As we wrap up this section, keep in mind that our bodies are like intricate puzzle solvers. Changes in appetite might be a piece of the puzzle telling you something about your liver health. Now, we are going to discuss Section 7, Fatigue and Weakness. We've all had those days when we feel a bit tired, but when it becomes a persistent companion, it might be your body's way of waving a flag in the direction of your liver. Imagine this: you're getting a solid 7 to 8 hours of sleep, you're not burning the midnight oil, and yet you wake up feeling like you ran a marathon in your dreams. That unshakable fatigue can sometimes be linked to liver issues. The liver is a powerhouse when it comes to energy production and storage, and when it's not functioning optimally, it can leave you feeling drained. Now, let's talk about weakness. It's not the same as fatigue. Weakness is that feeling of not having the strength to carry out your usual activities. It's like your body's way of telling you it needs a little extra support. The liver's role in processing nutrients and toxins is tightly connected to our energy levels, and any disruption in this process can lead to weakness. Precautions time. First and foremost, don't ignore persistent fatigue and weakness. While these symptoms can be linked to various factors, including lifestyle and stress, they can also be signals of an underlying health issue. If you find yourself constantly battling fatigue, it's time to consult with a healthcare professional. Next, prioritize quality sleep. The importance of a good night's sleep cannot be overstated. Ensure you're creating a conducive environment for quality rest: dark, cool room, and minimal screen time before bed. A well-rested body is better equipped to handle the demands of the day. And here's a crucial one. Pay attention to your stress levels. Stress can take a toll on your overall well-being, including liver health. Incorporate stress-reducing activities into your routine, whether it's meditation, yoga, or a calming hobby. Remember, our bodies are incredible communicators, and fatigue and weakness might be their way of saying, "Hey, something needs attention." If you're finding this information valuable, don't forget to hit that like button and share it with others. Let's move to Section 8, Spider Angiomas and Caput Medusae. No, we're not talking about characters from mythology. We're talking about visual signs that might be telling a story about your liver health. First up, spider angiomas. No, it's not a creature from a horror movie. It's a skin manifestation that can occur when there are changes in the blood vessels due to liver issues. These spider-like clusters of blood vessels might appear on your skin, often on the face, chest, or back. It's like your body's way of painting a picture of what's happening beneath the surface. Now, Caput Medusae. Don't worry, we're not summoning any mythical creatures here. Caput Medusae refers to the appearance of dilated veins around the navel, creating a pattern reminiscent of the head of Medusa from Greek mythology. It's a visual cue that there might be an issue with blood flow related to the liver. Precautions time. First, let's be clear, not everyone with spider angiomas or caput medusae has liver damage, and these signs can also be related to other conditions. However, if you notice these visual changes, it's a good idea to bring it up with your healthcare provider. They can conduct further assessments to understand the underlying cause. Next, let's talk about overall liver health. Supporting your liver involves lifestyle factors. Maintaining a healthy weight, regular exercise, and a balanced diet contribute not only to your overall health, but also to the well-being of your liver. And here's a key point. Moderation in alcohol consumption. Excessive alcohol intake can have detrimental effects on the liver, and it's a common factor in liver damage. If you enjoy a drink, do so responsibly and within recommended limits. Dear listener, our bodies communicate in unique ways, and these visual signs might be your body's way of saying, "Hey, pay attention." If you're finding this information valuable, give us a thumbs up and share it with others. We're on the home stretch of our exploration into the weird signs of liver damage. Get ready for Section 9, Bad Breath. Yes, your liver even has a say in your breath, and it's not just about what you had for lunch. So, let's talk about the connection between liver problems and bad breath. The liver plays a crucial role in filtering toxins from the body, and when it's struggling, these toxins can affect your breath. It's like your body's way of giving you a signal that something might need attention. Now, bad breath can have various causes, from poor oral hygiene to certain foods, but if you're finding that it persists even with good dental care, it might be worth considering the liver's role in the equation. Precautions. Time. First and foremost, maintain good oral hygiene. Regular brushing, flossing, and dental checkups are essential for overall oral health. Sometimes, bad breath is simply a result of bacterial buildup in the mouth. Next, stay hydrated. Water helps flush out toxins, and proper hydration can contribute to fresher breath. It's a simple yet effective way to support not just your liver, but your overall health. And here's a reminder about alcohol consumption. As mentioned in previous sections, excessive alcohol intake can contribute to liver damage. If you notice persistent bad breath and you're a heavy drinker, it's a good reason to reassess your alcohol habits. Remember, these signs are like puzzle pieces, and they might not individually confirm liver damage. However, they serve as clues to encourage you to pay attention to your overall health. If you're finding this information valuable, don't forget to hit that like button and share it with others. My worthy viewers, we've covered a lot today, exploring the weird signs that your liver might be sending out. From jaundice to changes in appetite, our bodies have unique ways of letting us know when something's up. So, if you found this information valuable and you're as passionate about health as we are, consider hitting that subscribe button. By subscribing, you'll stay updated on all things health-related, from uncovering the mysteries of the human body to practical tips for maintaining a healthy lifestyle. Our goal is to empower you with knowledge so that you can make informed decisions about your health. So, hit subscribe, join our community of health enthusiasts, and let's continue this journey together. Remember, your well-being matters, and a proactive approach to health is the first step towards a happier, healthier you. Thanks for tuning in today, and until next time, take care, stay curious, and prioritize your health. See you in the next video.